Good afternoon, everyone. Today, I will be discussing screening for trisomies in vanishing twins, and I will highlight different aspects in this respect. At 1945, the first time Stockeu commented on a vanishing twin phenomenon, and he suggested that twins are more often conceived than born. And a few decades later, really after the introduction of ultrasound in obstetrics, Keith and Landy described the vanishing twin syndrome as a disappearance of one or two gestational sacs or embryos after documented fetal activity. Now, the prevalence of this condition in a spontaneous conception is at about 7%, but of course this comes from data from the late 80s on a rather small number, whereas those pregnancies that were achieved after assisted reproductive technologies, because the infertility clinics are offering quite a series of scans in the early pregnancy, the prevalence was found to be 10 to 30%. Now, what would be the consequences of this condition in early pregnancy? Well, vaginal splitting and spotting were the most common one, and the evolution is full reabsorption without leaving a trace, or findings of placental cyst or amorphous material at birth, or even fetus papyraceous. And now the question is, what is the most important in differential diagnosis? Well, when we see a single demise in a monochorionic pair, we should always be thinking of a trap sequence, and we must place a Coward Doppler to identify if there is a presence of a blood flow, which is a trap sequence essentially. Now, what about the first trimester combined screening test? And I will go with you systematically to what is the literature evidence. And a study that is coming from 2006 has looked at 41 cases of vanishing twins and compared them with 4,500 singleton pregnancies. And it reported that when the blood sampling took place within 28 days after demise of one embryo, then the levels of papae were very much increased, but also they found that the levels of free beta ECG were increased too. Another study has reported a contradictory results, and those was the study coming from Denmark, from Professor Antabor. They have looked at 56 cases of vanishing twins, and they found that there were no difference in between the biochemical markers. Another study of Spencer, together with Professor Nicolaides, has looked at 217 cases of vanishing twins, and they reported that the levels of papae were increased when there was a visible embryo, and there were no difference in the biochemical markers when there was an empty gestational sac. And a few years later, Huang and the Canadian group has looked at 137 cases of vanishing twins, and they have reported that the levels of papae were increased when the blood sampling took place within 28 days after fetal demise. And what we can conclude from all this evidence, first of all, that we could perform a first trimester combined screening test, and in a case of a vanishing twin with empty gestational sac, we can use the nucleotranslucency thickness measurements plus free beta ECG and papae. But in a cases when we have that embryo, we should use the measurements of nucleotranslucency plus free beta ECG. And now, based on all these evidences, the National Screening Committee in the UK has recommended that in a case of a vanishing twin, when the second sac is empty, we should calculate the risk for trisomies based on nucleotranslucency, papae, and free beta ECG. And in a case when the second sac contains a dead embryo, the risk should be calculated only on measurements of nucleotranslucency alone. And also they has recommended that in such cases, we should offer a quadruple test. But that, of course, is wrong. And I want just to remind you that the several studies from the past has been evaluating the levels of alpha-fetoprotein when we do an embryo reduction at 12 weeks. And this persists high. And I just want to remind you that in a case of a Downs, the AFP levels are reduced, where in these cases, they will be elevated, and therefore this will mask the presence of a Downs. Now I will introduce our study. It is a collaborative project between King's College Hospital and Video Medicine Center in the UK and our unit in Bulgaria. And we have been looking at the routine first trimester assessment of all the women that have been entering all these three centers. We identified 528 dichorionic pregnancies with vanishing twin, and we matched for each case of a vanishing twin 10 normal singleton pregnancies, and we adjust for the method of conception and the day of sampling. And the mean gestational age was 12.4 weeks, the mean maternal age was 35 years, and in 60% the conception was through IVF treatment. And those are the results really, and you can see on the graph on the left, the blue line represents one mom in the normal singleton pregnancies, and the red dots are coming from pregnancies with vanishing twins, which are summarized in the subsequent graph by the time of estimated fetal demise. And free beta ECG mom is not significantly different from that of singleton pregnancies, and there is no change with the interval between fetal demise and blood sampling, and that was true also for cases with empty gestational sac. But we found, unfortunately, contradictory to the previous studies, that the level of PAPA was higher in vanishing twins than in normal singleton pregnancies, both in the group with the empty gestational sac and in those with the dead embryo. In vanishing twins with the dead embryo, PAPA mom is inversely related to the interval between estimated gestation and embryonic demise and blood sampling. Now, what would be the consequences of screening in vanishing twins? Well, I just want to remind you, if we take a singleton pregnancy and we use only the measurements of nucleotranslucency thickness, then the detection rate will be at about 82%. But if we add free beta ECG, we will go up to 86%. And if we add PAPA, we will go up to 91%. So the conclusion of the presented new research is that in the first trimester screening for trisomies, in vanishing twins, empty sac or dead embryo, nucleotranslucency thickness plus free beta ECG can be used. The addition of PAPA requires an appropriate adjustment for the interval between estimated gestational age at embryonic demise and blood sampling. Now, what about the cell-free DNA test in the case of a vanishing twin? Well, the existing literature has suggested that it would be inappropriate to offer cell-free DNA testing, and this is because the DNA that comes from the dead placenta or the dead tissue persists into the maternal circulation for at least 15 weeks. And I thank you very much for your attention.
Thank you very much, Petya. Very clear. The recommendations in England of the National Screening Committee are wrong. You must not do a second trimester serum biochemistry when you see a vanishing twin. You must not. You will get the wrong result. And you must not include the measurement of PAPA if there is an embryonic pregnancy. The best you can do is use the combined maternal age, nucleotranslucency, and free beta HCG, or depending on the timing of the estimated fetal death, then adjust appropriately for PAPA.